Good evening, Dr. Paul. We are very happy to know that you are using most of the time in bigger uterus and fibroids, 18 or in bigger size of cutting blades while morcellation. So I would like to know that is there any concern, or some doctors sometimes have an apprehension that when you use bigger size of cutting blades it could lead to maybe hernia or some kind of issues. Can you just address this?
Minimally invasive surgery, definitely we like to have the smallest incision. But morcellation is sometimes when you have a fibroid of 6, 7 or 8 centimeter, it takes very long time. And also some myomas are so soft or they are not very cohesive. When you morcellate, they come into small pieces.
Okay.
So an optimum size of morcellator is always easier for a surgeon as well as for the patient. You can finish the surgery quicker.
Okay.
So we have tried with 15 millimeter. The problem with the 15 millimeter is when you have a 8 centimeter, 9 centimeter, it takes much longer time, and especially the blade is slightly less sharper. They cut into smaller pieces. So I prefer an 18 millimeter because the actual incision site becomes approximately 2 centimeter. And we normally dilate and stretch it and pass the morcellator. Not actually we are cutting the muscle or anything.
Okay.
So that should not make a difference in the higher incidence of hernia. And we always suture. Any 15 or 18 millimeter should be sutured properly. The sheath should be approximated properly.
Okay.
So we do laparoscopic suturing, and normally one single perfect suture is good enough, whether it's 15 or 18 millimeter.
Did you have any incidents of hernia, post-op hernia, because of using a little bigger size of cutting blade, or even with 15
Actually, we have not come across any hernia, especially at the, I normally use the incision at the suprapubic site. Suprapubic site, the incision hernias are comparatively very less compared to umbilical hernias. The only disadvantage is to make a bigger incision, so that wound may be little more bigger scar, but definitely a safe surgery is more important than little bigger incision.
Okay. I understand with the 15 mostly if you take a 45 minutes to 15 minutes for morcellation, but while with the 18 the time would be reduced almost maybe 10 to 12 minutes time. So that means 30 minutes you are saving in the surgery time.
Definitely those bigger ones which are difficult to hold and which are difficult to cut into perfect shapes, it saves a lot of time.
Even with the 20 so we are launching the 20 also recently, maybe in very large uterus or very large to debulk it. Would it be of help? Maybe 18-20
I am not very sure about the 20 millimeter ones.
2 centimeter basically.
2 more, yeah. But in selected cases, when you have a quite big one, and in those cases probably you can choose. But as a routine, 15 and 18 is the commonest. Anything less than 5 centimeter or 6 centimeter, 15 is good enough.
Okay.
But when it is more than that, I always prefer 18.
We have 10 and 12 also, doctor, for younger patients and smaller fibroids. To make it a scarless surgery, we have the smaller size also, 10 and 12 also.
You can selectively use if you can afford to buy all various sizes.
So hernia won't be an issue or any such.
I don't think, because we have done very large series and
absolutely.
We not come across any hernia till
2016 onwards we are using our 18 So I think for last 9 years nothing of that sort.